Hey there, welcome to this video titled, Think you have IBS diarrhea? Here's what not to do. Okay, so what we're not going to do is ignore red flags. You know, a lot of times we have the explanation that it's just your IBS, when in fact we have some red flags that fly under the radar more often than not. A few obvious ones are blood in the stool, fever, vomiting, diarrhea that, has you losing weight. If you have a family history of bowel disease, like inflammatory bowel diseases, Crohn's, colitis, or a family history of colon cancer, or severe persistent abdominal pain that basically sends you to emerge. Those are kind of the seemingly obvious ones. However, the ones that kind of fly under the radar are the new symptoms after the age of 50. So if your bowels were moving tickety-boo, and at some point after the age of 50, things just all of a sudden started, this is a big red flag. I see a lot of, especially women after age 50, being diagnosed with IBS diarrhea, when in fact there is microscopic colitis, pancreatic insufficiency, and several other explanations that we wind up finding as we work together. Iron deficiency anemia, especially if it doesn't respond to iron pills, this is another red flag at any age, really. And diarrhea that wakes you up from sleep, this isn't just you woke up early and had to poop. It's, when you're waking up at night, having to open your bowels more often than what you usually do. So nocturnal bowel movements could signal there's something organic at play here, and maybe perhaps not just IBS. So what to do then is bring the symptoms you have, especially if there are any of these red flags, to your doctor and ask them, have I been properly worked up? Do I have any of these red flags? Have I been properly tested in blood and stool? You can look at a different video for the blood tests that I recommend. And these will obviously be based on the opinion with your healthcare provider, factoring in everything about your health history. So this video is obviously for general information only, but usually the algorithm for diagnosing IBS does include a stool test, such as a fecal calprotectin. This helps rule out inflammation as a driver of the diarrhea. If there's inflammation, this could mean something like an inflammatory bowel disease or chronic infection, for example. An infectious diarrhea panel, if you had the diarrhea after recent food poisoning or traveling to a developing country, an infectious diarrhea panel is really one to ensure that you have had. And of course, any other imaging and procedures that the doctor may recommend, especially if you've been referred to a GI, really may need to follow up if you have any of these red flags. What not to do, point number 2, is do not cut out all the foods. Please try to not to fall into the I can't eat anything trap. Cutting out gluten, soy, and dairy is what I see a lot of patients come to me because they've had an alternative healthcare provider say that this is the root of a lot of food allergies or intolerances, when rarely I find this is the case. If there's something up with gluten, this should already have been screened out in your blood test called a TTG, that's screening for celiac disease. So make sure that you do not cut out gluten, especially from the diet, before you get this test. Otherwise, it renders the TTG blood test unreliable, as a few other factors do as well. So don't live on, 5 safe foods and air for months on end, because this can backfire. Nutrient gaps, especially copper, zinc, magnesium, calcium, protein even, less diverse gut bacteria. If we don't expose our gut bacteria to variety, we can drop in their abundance and variety. And it really leaves us with no real idea what the triggers are. If we've cut out everything, then we're kind of hesitant to bring things in. So instead, I personally practice with the least restrictive diet first. If you can, if your budget allows for you to invest in help with a specifically trained dietitian who does GI stuff all day, every day, ideally. Ask them their skill sets, how often they work with patients with what you're going through. These are questions that you're allowed to ask at any time to find the right practitioner for you. Most practitioners know that they shouldn't jump into a ton of restrictions, and at the very least discuss, say, the gentle low FODMAP diet instead of a full FODMAP diet. But at the end of the day, IBS isn't all about the food. Diet is only one tool. And again, it depends on the kind of root cause or causes of your diarrhea in order to decide which diet might be the best suit for you, right? Number 3, don't overdo caffeine, alcohol, and sugar alcohols. These are hidden gut accelerators, making your gut go faster, irritants, and when we irritate the colon lining, we tend to get a lot of water in the colon, and this makes stools a lot looser, especially if we are consuming lots of water magnets like sugar alcohols. So sorbitol, mannitol, xylitol, erythritol, anything with a tol, these have a really good water magnet property. Fructose as well. They pull water in, and it's really difficult when there's water being pulled into the bowel and there's not enough time for stool to stay in your bowel to get this water reabsorbed before the stool comes out. So if you do anything, this might be the biggest bang for your buck. All coffee has caffeine and chlorogenic acid if it's regular coffee, but even decaf will still have chlorogenic acid. So if you can switch to peppermint tea, eliminate alcohol and sugar alcohols, and just see how far that takes you, that might be some really good data for you. And so other tips, read the labels. If you see anything in tol, that's a sugar alcohol, keep alcohol modest or pause it completely to see if you have any progress with your diarrhea, and try to limit coffee to a cup a day, or choose decaf or espresso drinks because they have less chlorogenic acid and less caffeine because there's less volume. Okay. Number 4, this is very tempting for people with diarrhea to do, is to skip fiber completely. So IBS-D and fiber, if it feels like it makes you worse, it might not be always and with every type of fiber. So what not to do is avoid all fiber long-term, or suddenly pile on insoluble fiber because someone says, your diarrhea is because you're just not eating healthy enough. So someone can pile on big salads, all the chia seeds and the bran and raw veggies, and sometimes that makes us feel worse. So that backfires because it's not about total fiber. It's about the right kind of fiber and the right amount that can help actually form stools and slow things down. My favorite is acacia fiber, as you've probably heard me say multiple times. There's also resistant starch foods, which is when starch is cooked and cooled, like cooked and cooled rice, cooked and cooled potatoes, cooked and cooled pasta, like pasta salads. Masa corn tortillas made from masa flour. This is a hidden gem that you might want to try. With all these fiber and resistant starch sources, start slow and drink enough water and see if these help slow down your gut and form stools. Number 5, don't ignore stress, sleep, and anxiety. IBS lives in the gut-brain axis. IBS is a disorder of the gut-brain interaction. See the other video on this topic if you're interested in what exactly is the gut-brain axis and how it influences someone with IBS diarrhea. So what not to do, don't assume it's all in your head, though the fix might just be. Try your best to not ignore the impact of stress, burnout, poor sleep on your symptoms, because when we put this aside as not a possible cause of the diarrhea, it can actually crank up our gut sensitivity and speed things up if we're not doing things like what I'm about to list here. So take what goes on upstairs seriously. Tools that can help: gentle movement. Maybe it's not the time to do high intensity interval training when you're having diarrhea. That kind of jostles the organs of the gut around and can actually increase gut speed and bowel movements. Diaphragmatic breathing, cognitive behavioral therapy, or gut-directed hypnotherapy. As you know, I have that highlighted there because this is the first step in my programs, is gut-directed hypnotherapy, because it is by far and above the most effective intervention for IBS-D, and that is factoring in medications and diet. And protecting sleep as much as you realistically can. I get it. I used to be a mom of tiny babies. Sometimes we can't get the sleep, but you can do your best to protect it by shutting down screens early, reading in bed, and really just trying to be a little more consistent with your sleep and awake schedule, as much as you can possibly control. There are some factors in life that we actually can't, such as babies that wake up in the night. Try not to ignore the possibility of bile acid diarrhea. That's what BAD stands for, or SIBO, because sometimes IBS-D has layers. I find more often than not it's not IBS diarrhea, or it's IBS diarrhea and. The two ands I see in my practice most of all are small intestinal bacterial overgrowth, especially if you found that your diarrhea started after a food poisoning incident, giardia, say you went camping and you had some contaminated water or food. This can oftentimes lead to post-infectious IBS and some gut microbiota disruption. So a couple of clues to this is, do you experience lots of bloating, gas, and discomfort fairly rapidly after eating, like anywhere from 30 minutes to a few hours? That can vary depending on the location and the type and the severity of any sort of bacterial overgrowth. Typically with IBS diarrhea, if there's no overgrowth, I don't see gas, bloating, discomfort, and abdominal pain happen until at least 3 hours after eating a meal that has some sort of, say, high fermentable carbohydrate in it. Bile acid diarrhea, this is really the telltale of this I find in my clients is urgency. That's especially worse after higher roughage, like that higher insoluble fiber note I was mentioning, and higher fat meals. Not always though. If you've had your gallbladder removed, you are at increased risk for bile acid diarrhea. There's several different types of bile acid diarrhea, but in general, the bile acid diarrhea that I see most in my practice may be related to SIBO itself, because SIBO can actually interfere with your body's ability to process bile acids. When excess bile acids reach your colon, the colon gets irritated, throws water in there, and we get diarrhea. So things that you can ask your doctor is, should we consider empiric treatment for SIBO? That basically means, can we just treat this as a possible layer SIBO or rooted in SIBO, especially if you've had, say, that post-infectious diarrhea history? An empiric treatment for SIBO could include something like a non-absorbable antibiotic like rifaximin. Now, rifaximin isn't going to completely napalm all your native gut microbiota. It's going to actually weed out the bad guys like E. coli, K12, and Klebsiella that are implicated in a lot of SIBO. If you want to ask them, hey, doctor, I don't have a gallbladder. Could bile acid diarrhea be part of this? That's another kind of cue, because remember, your family doctor sees probably 2,000 people, and sometimes they need to be cued as to your medical history, some relevant facts about it at an appointment where you're discussing something like diarrhea. So hopefully they can help you connect the dots and go forward with a solid plan. All right, and yes, again, we could also have both, because if we have overgrowth, especially in the last section of your small intestine called your terminal ileum, there might be an issue with your body's ability to process bile acids and recycle them appropriately if there's too many gut bugs hanging out in that area. So oftentimes when we solve the SIBO, we might also solve the bile acid diarrhea and possibly the IBS diarrhea as well. Okay, I hope this video was helpful. Thanks for being here. If you want to grab your free IBS diarrhea mini guide, it's available on my website, and I'll see you in the next video. Bye now.